We're getting people connected, hopefully, in a lifelong mission of caring for the underserved, getting access to folks who need it the most.
Cahaba Medical Care as a clinic is a unique entity. We, as a corporation, have multiple clinics that are in multiple communities, and each one of those clinics has its own niche and its own impact on the community.
Here at the West End site, the residency program kind of lays the foundation for the clinic. There's the whole sense of continuous learning that's built in that's kind of throughout medicine, but it's much more evident here at a training clinic like ours.
The residents being in a community make all the difference.
We've benefited a lot from getting to know a lot of the patients in clinic, but also we see a lot of them outside of clinic.
Most of the times that I see my patients, it's inside clinic walls, which you can get to know a patient some, but not fully. Here at Cahaba, we have the awesome opportunity of seeing patients outside clinic walls too, in their homes.
Not only are we bringing physicians to this area, but we're also training physicians in these areas. It's always our goal as we're training these residents to practice holistic medicine.
Continuity of care is something that family medicine doctors crave. It's one of the reasons that we're in the field that we're in.
I think our organization works hard to look at the entire patient.
It's been a unique challenge in getting people to reframe how you work in the healthcare setting. Hey, this is when you go to your primary care doctor, and this is when you go to the ER.
One of the things that makes family medicine obstetrics unique is the ability to provide continuity of care for our patients. When we have that ability to continue that care and do for our patients what we've been doing for them their entire pregnancy, that just provides a level of comfort and reassurance that they wouldn't have otherwise.
In the OBGYN clinic, we have 2 residents that are there with us. They get a chance to see the surgical side of women's health.
We teach the residents in that clinic how to take care of the pregnant patients in our clinic. And then I also take call at Princeton and deliver babies. And so we have residents with us there teaching them how to actually deliver babies and take care of the babies once they're delivered.
My clinic experience has been awesome. I feel like I have a really good mix of OB and women's health, as well as a ton of uninsured patients, which is such a gift to be able to care for that population.
We will see you without insurance, that you can walk in the door and be seen and not have to pay. Getting that word out to people that don't realize that they have access that they have.
The recent development of ultrasound as kind of the imaging modality that's transportable, easily interpretable, and can be applied in so many different situations, we've just recognized the need for all our residents to be trained in that.
Ultrasound is something that's very exciting to me. I find that it's going to be an increasingly more and more important skill that's translatable to just about every context: clinic, hospital, overseas medicine. And here at Cahaba, there's opportunities to practice it in each of those contexts.
It's a pretty up-and-coming field, and it's a newer thing to have ultrasound readily available. Not only to have it, but to have curriculum where it encourages you to learn it well.
MAT stands for Medication Assisted Treatment. It's treatment for opioid use disorder. We realized what a big need there was, especially in Jefferson County. We've been able to train all the attendings to be confident in providing that kind of care.
MAT is another piece of our longitudinal curriculum. I see women's health as a huge part of primary care. I see like pediatrics as a huge part of primary care. It's like, oh, we're in the middle of an opioid epidemic. MAT is a part of primary care. What's cool about Cahaba is that it is an atypical kind of format. In any given day, like I'll have these crazy, what I call family medicine days, where I'll like deliver a baby and then do a paracentesis, prescribe a new mental health medication, all in the same day because of this longitudinal curriculum. And you like sit back and like, wow, I did like the full span of family medicine today.
Our desire to really know our patients and show self-sacrificial love has bled over into the care and love that we have for our patients. The better we understand our patients in our community, the richer the services that we're able to provide for them.
It's also bringing folks that have felt forgotten, that have felt overlooked, that have felt neglected, and bring them into the fold of medicine so that they can be healthier versions of themselves.